This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Na mata at gising na tenga, mga daliri na nagkakaisa, sa bawat kilos makakalampag, siglab ng umaga magliliwanag.
Good evening, Philippines. We will talk about amoebiasis. What is amoebiasis? Amoeba, the genus of protozoa. The cells, organelles, and cytoplasms are enclosed by a cell membrane, obtaining its food through phagocytosis. Amoeba has a single large tubular solupod at the anterior end and several secondary ones branching to the sides. Amoebiasis is an infection in the bowel, particularly the colon, characterized by a diarrhea. This infection can be fatal in infants and to older people with low resistance. The main risk is due to dehydration from the loss of fluid. Symptoms can range from mild diarrhea to dysentery with blood and mucus in the stool. Severe amoebiasis infections occur in two major forms. First is the invasion of the intestinal lining causes amoebic dysentery or amoebic colitis. If the parasite reaches the bloodstream, it can spread through the body, most frequently ending up in the liver, where it causes amoebic liver abscesses. Liver abscesses can occur without previous development of amoebic dysentery. When no symptoms are present, the infected individual is still a carrier, able to spread the parasite to others through poor hygienic practices. Transmission. Usually transmitted by the fecal-oral route, but it can also be transmitted indirectly through contact with dirty hands or objects, as well as by anal-oral contact. Infection is spread through the ingestion of the cyst form of the parasite, a semi-dormant and hardy structure found in feces. The life cycle of Entamoeba histolytica is relatively simple and alternates between the actively metabolizing motile stage, the trophozoite, and the dormant environmentally resistant cyst. The preponderance of each of these stages, example, trophozoite or cyst, depends on whether the individual is carrier or has amoebic dysentery or diarrheic stools. The life cycle goes like this. As cysts are ingested, trophozoite emerge in small intestine and multiples and invades the colon. Some trophozoites insist in the colon and pass in the feces to continue the cycle. In a small percentage of infections, the trophozoite emerge in small intestine and multiple and invades the colon. Some trophozoites in the feces to continue the cycle. In a small percentage of infections, the trophozoite also invades other organs, such as the liver and brain, and causes abscesses. One should call the doctor when signs and symptoms of amoebiasis occur. This includes diarrhea with blood or mucus, abdominal pain, fever, distended abdomen, pain or tenderness in the area of the liver. Prevention. To help prevent the spread of amoebiasis around the home, wash hands thoroughly with soap and hot running water for at least 10 seconds after using the toilet or changing a baby's diaper and before handling food. Clean bathrooms and toilets. Pay particular attention to toilet seats and taps. Avoid sharing towels. Nature of the disease. Infection can sometimes last for years. Symptoms can range from mild diarrhea to dysentery with blood and mucus. The blood comes from amoebae invading the lining of the intestine. Treatment. Entamoeba histolytica infections occur in both the intestines and in tissue of the intestines and liver. As a result, two different classes of drugs are needed to treat the infection. one for each location, such as amoebic drugs are known as AMOEBIASIS.
And here is the video of amoeba in motion.
Bulat na mata at gising na tenga, mga daliri na nagkakaisa. Sa bawat kilos makakalampag, siklab ng umaga magliliwanag, magliliwanag.
Walang mahimbing sa sariling mundo, walang iwaldas ang dekadang bago.
Ako ang tutupad sa pangakong ito, ako ang simula ng pagbabago, sa pagbabago. Ako ang simula, ako ang simula, ako ang simula, ako ang simula. Huwag nang masinda sa ingay at gulo, huwag nang mag-abang na itulak tayo. Ako ang tatapos sa pagsubok na to, ako ang simula ng pagbabago, sa pagbabago. Ako ang simula, ako ang simula, ako ang simula, ako ang simula. Saan at kailan at kung paano ako ang tutupad sa pangakong ito, ako ang simula ng pagbabago.